So coming to the point, the second half of juvenile idiopathic arthritis, where there will be joint arthritic changes. In the acute stage, the patient will be having severe pain, reflex muscle spasm around the joint that causes decreased range of motion, and because of the pain, decreased range of motion, their functions and participations in the life will be affected. The joint will be swelling, range of motion will be decreased, there will be redness around the joint. All these problems will be there in the acute stage. So now we will see how to manage this particular kind of condition. The focus of physical therapy during the acute stage of the disease is different from during the subacute and chronic stages, because we will deal according to the problem of the client or the patient. While in the acute phase, efforts are focused on maintaining and preserving joint function. So we want to maintain the joint alignment, joint structure. We don't want to damage it. We want to decrease the pain. But the chronic stages or subacute stages, once the joint destruction is already happened, then we'll try to compensate the function by doing some other alternative activities. So now I will tell one particular strategy of management. Then by this particular strategy of management, what you are going to be getting as a goal and how you are going to do this particular strategy as a therapy. The first strategy of management of joint health is coordination, communication, documentation. That means if you do this coordination, communication, and documentation, then the care is coordinated with child, family, school, and other professionals. The insurance payers understand the need of rehabilitation services, and need for modification in the schools will be determined and documented. So this will be the anticipated goal. So how you are going to do? What we do is, first, available resources are maximally utilized. The decision making regarding the child health, wellness, fitness needs, they are all enhanced. Specific interventions like communication with the community therapist who is there in that locality, communicating with the school people, communicating with the community resource providers, then prescription and letters of medical necessity to support the rehabilitation needs, documentation of the child problems, communicating with the parents, and individualized educational plan development for that particular child. If they are going to miss the school because of the pain and lack of range of motion and unable to travel, participate in the school related activities, then they should develop an independent educational programs. Patient related instructions like anticipated goals, awareness and use of community resources are increased. Behaviors that protect the joints from secondary impairments are enhanced. For example, moving the joint into full range will prevent any deformities which are going to form in the later stages. Even though if it is painful, still if they are doing that, it will be good. The functional independence in activities of daily living are increased. Patient and family knowledge of the diagnosis, prognosis, interventions, goals, outcomes, everything should be educated properly so that their participations will be good. So that is what is patient related instructions. So what you are going to do in patient related instructions? We give home exercise program, we give some materials related to the disease to the client, or we give instructions regarding joint protection principles. We may teach some activity programs, information from Arthritis Foundation regarding the disease, referral to other community resources. All these things can be done to protect the joint. So first one is communication. Second one is patient-related instructions, strategies I am talking about. Third one is exercise, therapeutic exercise. So what is the goal you are going to achieve when you do exercise? Their ability to perform physical tasks related to self-care, home management, community, school integration, leisure activities will be increased. Their aerobic capacity will be increased. Their gait will be improved. Their joint and soft tissue swelling, inflammation, and restrictions is reduced. The joint integrity and mobility are improved, pain decreased, postural control will improve, strength, power, endurance improved. So what you are going to do in the therapeutic exercises? We do aerobic exercise program, or aquatic rehabilitation exercise program, or any kind of low impact weight bearing exercises like supine exercises, sitting exercises, lying down exercises. All these exercises will decrease the load on the joint, but at the same time they strengthen the muscles. Along with this, we even give gait training. We teach good body mechanics, and we train for good body mechanics, postural training, strengthening, power endurance training, active, assistive, active, and resistive exercises as indicated by the patient capacity, task specific performance training, flexibility exercises, muscle lengthening, range of motion exercises. All these things will be taught to the patient. Next, like stretching, this is also part of therapeutic exercise. The next one is balance, coordination, and agility training. These all will be done under the exercise training. The third one is the next. So first one is communication. Second one is patient-related instructions. Third one is therapeutic exercise strategies. Fourth one is functional training in self-care and home management. So you are using function as a training. The ability to perform physical tasks related to self-care, home management is increased. Level of supervision required for task performance is decreased. Risk of secondary impairments will be decreased when you are trying to do functional training in self-care and home management programs. So what you do, you teach them how to do their activities of daily living by themselves. Assistive and adaptive devices or equipment trainings will be done. Self-care or home management task adaptations, leisure and play recommendations, all these kind of instructions will be given so that they exactly know what happens when they do this kind of training. Orthotics, protective equipments, supportive devices or equipment trainings, the injury prevention training, all these things will be done as a specific intervention to improve their function in day-to-day activities. So that is functional training in the home. Same thing, the functional training in school, play, community, leisure integration, like what you are going to expect if you do functional training in the school, play, community. The school attendance will improve, the participation in peer group for recreation and leisure activities will be improved. The architecture barriers to access home, school, community resources will be removed when you are trying to go out. So what is the specific intervention? That is appropriate transportation plans to school identified on individual educational plan. Modifications to the school instructions identified on individual educational plan. ADL training, assistive and adaptive devices or equipment training. Adaptation of equipment to allow inclusion in recreation and leisure activity. Home and school site visit to plan accommodation of any architectural barriers if they are having. So next one is description, application and fabrication of orthotics like devices and equipments. So what will happen if you wear the orthosis? Your ability to perform physical tasks will be increased. Deformities are prevented. Gait is improved. Joint stability is increased. Optimal joint alignment is obtained. Pain is decreased. Protection of body part is increased. What kind of intervention? So you can use adaptive like assistive devices like ambulation aids, wheelchairs, ADLs, or you use orthosis like shoe inserts, splints, or you use protective devices like splints, taping, elbow or knee pads, supportive devices, compression of garments, cervical collars. Any of these devices will be used. Electrotherapeutic modalities can be used. This is also very good thing to decrease the pain. So it will decrease the pain, their muscle performance is increased. Here just I mentioned biofeedback, but you can use any machine which is necessary to decrease the arthritic problem like lasers or SWD, WD, ultrasounds, electrical stimulations, Russian currents. You can use any modalities which will decrease the pain and increase the muscle strength for these. Along with that, some physical agents like cold packs, hot packs, and other machines. What they will do? They will decrease the pain, soft tissue swelling, inflammation, and restrictions are reduced. Tolerance to the position and activities is increased. Joint integrity and modalities are improved. So all these things will happen when you try to use like cryotherapy, hydrotherapy, continuous passive motion devices. All these things will improve the patient condition. So the summary is the juvenile idiopathic arthritis is not a severe disease that which is going to cause any permanent disability unless you are careless. If you are careful from the initial disease modification process and you are giving the proper treatment for each and individual problems of the clients, then the most of the clients will have normal life without any disabilities. And with good physical therapy, strengthening, decreasing pain, decreasing swelling, maintaining the alignments, the patient quality of life will be improved to the maximum. So this is what is juvenile idiopathic arthritis. So hope it is clear and you don't have any doubts. Any doubts you can ask me. I am available.